Hello, everyone. Welcome. My name is Lorraine Persiuncula. I'm the Executive Director of the Datasphere Initiative. I'm going to share some short slides here with you today. It's a pleasure to be with you today. This is our fourth Regulatory Roundtable on sandboxes in Africa. Before we start, I encourage you to introduce yourselves in the chat. We like our meetings to be interactive, for people to be able to really talk to each other, tell them where you're from where in the world you're speaking. Feel free to really introduce each other and speak in the chat. Also, please turn your cameras if you can. This makes the event much more interactive as well. As you notice, the event is being recorded. And we'll be sharing the recording on our YouTube channel for those who can't join us today live. And so for those who are not familiar with the Datasphere Initiative, we are a nonprofit organization, a think tank dedicated to fostering global cooperation on technical and policy solutions for the urgent multidimensional and cross-border data challenges. We bring together voices from diverse sectors. We do research, we experiment with policy and technical solutions, and we work very closely with decision makers to enact change in data policy practices and strategies. And today's roundtable is a part of our Africa Forum on Sandboxes for Data. It's a project which was made possible with the support of the William and Flora Hewlett Foundation. Through this initiative, we aim to convene leaders in government, industry, academia, civil society, and the technical community to address cross-border data challenges with a particular focus on Africa. This session is going to delve into the transformative potential of sandboxes as tools for addressing the pressing challenges of health data governance, and a little bit of an intro on what that means. Health data is all data related to health conditions, reproductive outcomes, causes of death, and quality of life. More health-related data is generated today than ever before, from wearables and to the explosion of research and public health interventions since the beginning of the pandemic. An unprecedented amount of health data, both personal and non-personal, is now generated, collected, and transmitted, and this brings enormous public benefits. Pooling and the sharing of health data can really accelerate research and innovation and support better decision-making in public health. Conversely, growing health inequality can be driven by the lack of data or access to it, or its inappropriate use. And pooling and sharing personal health data can create collective benefits, but they can also impose costs and risks on individuals if they are identifiable with the data. So privacy here is truly essential. The release of personal data regarding reproductive health has typically raised a lot of concerns that could even lead to human rights abuse. And that's what the conversation that we are hosting today is about. The discussion will center on leveraging innovative environments to explore solutions for data privacy, security, interoperability, and the ethical use of health data in advancing public health outcomes. By bringing together a diverse group of experts, such as yourselves, and policymakers and practitioners, this roundtable aims really to foster a rich dialogue on creating collaborative frameworks that not only navigate the complexity of health data management, but also propel the health sector towards a more integrated, transparent, and user-centric future. And through this roundtable, we hope that you gain insights into potential of sandboxes in catalyzing change, in the role of multi-stakeholder arrangement in crafting agile, effective health data policies, and who knows, more cross-border collaboration, interoperability of data. Our previous roundtables focused on other issues such as climate and artificial intelligence, as you can see, and you can find the sessions on our YouTube channel. Then I also would like to share with you that we'll be hosting a survey, a Menti, throughout the session. You can participate on a survey through the QR code here. The team is also going to include the Menti link for you to click directly and participate in your computer or in your mobile if you're using it to access this session. And also, lastly, I don't want to forget to mention that we have an online course, which is a guide to cross-border sandboxes for data. There is a specific component of that dedicated to experiences in Africa. And so it's free to enroll. You become a certified sandboxer upon completion. And my colleagues will also share the enrollment link in the site. Now, without further ado, I'll like to hand over the virtual stage to Dina Montague. Dina is an environmental justice lecturer.
Oh, Lorraine, you're muted, but we're going to be handing over the floor to Olivier Abumbagisha, who is the director of the Health Tech Hub Africa, who will be moderating the first panel. So Olivier, thank you very much.
Thank you, Justin. Olivier, you have the floor.
Yes, thanks, Roland. Thanks, Justin. Yes, happy to be here. As reiterated, this panel will explore the intricate landscape of health data governance and interoperability in Africa. So that's the core focus of the session. Our two experts today will discuss the current state of health data management, barriers to effective data sharing, and the opportunities that can be leveraged to enhance health outcomes across the continent. So with us today, we have, we're hoping to have 3 experts, but right now we have 2 experts. First, Dr. Tom Olioch, who is the co-founder and chairman at the Kenya Health Informatics Association, as well as the branch chief strategic information at Center for Disease Control and Prevention. He's a health systems expert with extensive experience in designing, implementing, and evaluating digital health solutions in low-income settings. His contribution include leading large-scale e-health projects across the continent, providing technical assistance, and promoting innovative tools. He holds a PhD in medical informatics and has published influential papers in the field. His work continues to impact health informatics globally. Welcome, Dr. Tom. Second on the panel, we have Dr. Shiko Kitao, founder and CEO at Kala. Shiko is a digital transformation leader with expertise across multiple sectors, including health. Shiko founded Kala, a digital transformation agency, serves on multiple boards, and advocates for tech growth in Africa. Her work spans across public, private, and nonprofit sectors, focusing on empathy and innovation to impact lives. She is recognized for her contributions in technology and women empowerment in Africa. Welcome, Dr. Shiko.
Thank you.
Last but not least, Jean-Philbert Senkimana, who will be joining us later or not joining us, I'm not sure. Phil is the Chief Digital Advisor at Africa CDC, where he is shaping and implementing Africa CDC's digital health strategy, as well as collaborating with member states, AU, and development partners to revolutionize public health system through digital solutions. He is also advocating for seamless connectivity, impactful innovation, and adoption of digital tools to improve health outcome in Africa. Prior to this, Phil served in many senior leadership roles at Smart Africa, the government of Rwanda, and the Commons Project Foundation, among others. So without much further delay, I would like to start with a first round of questions to Dr. Shiko. What are the main challenges you see in the current health data governance structures in Africa from your experience?
Thank you, Olivier, and hello, everyone. It's a pleasure to be here. So it is interesting you asked this question. So I'm sitting here in DC talking about Africa, and every other day we have meetings with people across DC who are talking about Africa. And from here, when you look at Africa, it's one monolithic space. It's one piece of land. I always say it's one large piece of land in the middle of the globe. That's how people view Africa. So when you're thinking about governance, when you're thinking about interventions, they think of Africa as this one monolithic place. But when we are in Africa, because I'm technically based out of Nakuru, Kenya, not even Nairobi, which is more rural. Nakuru is more rural. Is we look at Africa as these 55 states, which I'm highly proud of. And the governance, the problem that is the governance is, first of all, each of our 55 states have their own ways of looking at data, from a data protection process to what is personal data is a question we've asked over and over again. What can be shared, what cannot be shared? At what point data sets can be shared? Not data sets, data can be shared between doctors. And when it comes to health is then you start going through the different policies, standards, regulation. And then you make it complicated. We're the one continent, okay, apart from India maybe, that our health sector is highly privatized, right? Which means that our data and how we manage it is in the hands of the private sector, which also builds extra levels of siloing. So I know a few years ago, maybe 2017, 2018, we attempted building what we're calling an one health platform. And the goal was to have you being able at an SMS, not even at a smartphone, at an SMS based, now we call them prompts, we are calling them instruction. You're able to give access to your health data to any doctor and any health facility. Oh my God. From a public sector, there is no data that we could be able, there was no way of storing this data in a way that this could actually happen. So it meant building some infrastructure from scratch, right? Then you go to the people who actually have like health management systems. They each have invested lots of money in their own private systems, which means that they will not give the data. Even if you put in policy, there is no interoperability policy around this. So it is all these multifaceted ways of looking at health data that is the challenge, yeah? And that is the challenge is, how do we then create, and I think I'm sad that Phil is not here. We've spoken about with Phil is how do we should we build an API that is able to pull, nobody's going to rebuild anything, nobody's going to do anything. We build an API that can pull data from different data sets, and then we just build our own standard that, I know this is first name, last name, age of birth, and there's some other mixed up information, and you're able to pull it and organize it we don't expect the information before the API to be anything useful. We organize, Phil is here. We organize it, like brainstorming on how do we make these interoperable health systems work, because it is very disjointed. And that is on one level. But when we try to explain it to the world, it's even worse. The way Europe looks at us is very, very different from the way the US is looking at us, and then the way we are looking at ourselves. So those are the challenges. Are they beyond repair? No. That's why this room is here, because we want to be able to ensure that we have the solution for our health. And I feel like now that Phil is here, I can throw him under the bus. He can speak to some of the solutions that we have brainstormed together. Back to you, Olivier.
Yes, thanks, Chico. Maybe before I get to Phil, and I'm not sure if he's able to use his microphone or camera at the moment. If he's able to, I recommend him to unmute himself and so that he can intervene later. But before I get to him, I want to maybe ask Dr. Olwach. I know this kind of conversations around data governance has been lagging for many years. And there are so many efforts, including associations like KEHIA, that are being implemented. So I want you to speak about the challenges that such associations are trying to address. Does that make sense, what Dr. Shiko mentioned, and how does associations like KEHIA, what kind of challenges are trying to address in this context?
Thanks so much, Olivier. And just to first thank you all for giving us the opportunity to present in this forum. Yeah, we are having connectivity challenges here since I'm based in Rwanda. I'm in Kigali right now. We're having serious connectivity challenges, so the internet is going on and off. So if I go off, just bear with me. I'll probably come back on after like a minute or two. So because of that, I request if I could be allowed to just turn off my camera, because I think it probably is going to make my connectivity a bit more stable. So if that's okay, then yeah, I'll go ahead and turn off my camera. So yeah, to come to your question about some of the issues that associations like KEHIA have to deal with regards to just overall issues around data governance and just data in general. KEHIA is a professional association that brings together professionals from various backgrounds, including technology, public health, law, and other areas that have an interest in promoting digital technologies in transforming healthcare service delivery. So, and again, I mean, this kind of association exists in multiple countries across Africa. And we have the umbrella organization association in Africa called HELINA. That's the Pan-African Health Informatics Association. So one of the things we're trying to do, like I said, we draw expertise from various areas, is just to try and understand what the key governance challenges. Because I mean, like HELINA, we deal with both the technology side in actually implementing solutions or working with different stakeholders to implement digital solutions in health service delivery, but also have to deal with issues around data governance, which includes protecting data within the various jurisdictions, ensuring quality of data, and just ensuring the data is accessed by the right people for the right use, for the right purposes, and stuff like that, which we know is a big problem, because unfortunately, I mean, in the countries where we work, largely things around data protection is not, I mean, the laws are just being enacted right now. The laws are lagging behind implementation. And for the most part, we've had situations where human citizens are not aware of their rights over their own data. And this has been taken advantage of by sometimes researchers or even other organizations that hold large data sets of individuals, which include sometimes personally identifiable information, which is not properly protected. And you never know what this data is used for, sometimes to the disadvantage of the citizen whose data is being used for such purposes. So for HELINA, I mean, first of all, the key challenge is first to understand and enlighten the policy level on the need to have the appropriate governance and regulatory environment, which can ensure that data is properly protected, and then that is properly used for the purposes that it's collected for, and also just being sure that people are general public awareness about their own rights over their own data. So things like that are like key challenges that associations like KEHIA and HELINA have to deal with, as we work with other key stakeholders like Africa CDC, we work with the local ministries of health and other key players, international partners, implementers, and so on, to be sure that we're on the same page and the same understanding in the right policy environment to ensure that data is properly governed, properly protected, and properly used for the right purposes. So maybe I'll stop there for now.
Thanks, Tom. Now coming back to Phil, with this kind of perspective, so Dr. Shiko mentioned a few challenges around the siloed efforts being made around data management, and also the fact that majority of data is in the private sector, which makes it so hard to govern, and also the lack of interoperability structures among the data blocks. So I want to understand from Africa CDC and also the macro level perspective, is there any challenge that you foresee currently in terms of health data governance?
Yeah, thanks, Olivier. Good morning and good afternoon, everyone, depending on how you are. Sorry I caught you in mid of the flight, but I'm glad I could catch it nevertheless. Every challenge that Dr. Shiko talked about, and also Dr. Tom, resonates deeply with what we've observed also throughout our interactions with member states, with countries. And you feel like there is a bit of frustration because all of the challenges are things that are solvable. I think that's also the point that Shiko made. It's not beyond repair. And the kind of solutions that are needed to fix those problems are actually not difficult on a technical standpoint. And I recognize most of us here on this call come from a technical background. So the frustration is you see the problem, you see the solution, but for some reason, the solution doesn't touch the problem, because the problem is, whereas it may look like a technical problem, but it's mostly governance problem. It's leadership. It's perhaps capacity or resources, but technology is never the biggest problem. So let's pick, for example, the question around interoperability, which leads to fragmented data space. And we know how to fix it. We know that if we all adhere to a certain agreed set of standards, we can fix it. And we know that by stroke of a pen, the policymakers can just make it mandatory for all the health tech applications and solutions to follow a certain standard. That's doesn't even have a cost implication on the side of the policymakers and the regulators. Just write it in a document, and then the rest will be enforcement. Of course, there will be issues in enforcement. I think Tom also mentioned that. It's not difficult, but this is where also I think we can help as the technical community in enforcement, because the moment those principles are had encoded in the platforms, you can even forget about enforcement because they are auto-enforced. So to what extent in our respective domains are we also promoting the adoption, even voluntary adoption of those kind of best practices? I believe what the policymakers can do is to put up the right incentives, like positive, but also negative incentives, in form of sanctions, especially where the regulatory and the legal environment has been put in place. And there are so many places like that. I don't know in your experience, Tom. I know Kenya has a very strong data protection law. Rwanda has a very strong data protection law. I'm sure somebody would have conducted a study to see. In fact, Transform Health has done it very, very recently to determine which countries have up-to-date data protection laws that extend to health data that are adequate enough to help us make progress, and which other countries are still lagging behind on that. I haven't seen the outcome of that document, but my sense is, in terms of having the laws, we could be in a good place. The problem is always enforcement. I can even cite the example of Rwanda, which is the country I know the most. Some of the measures in the law are the things that are, like very simple in principle, like your data is your data. You are the sovereign as an individual, you are the sovereign on your data. You can do whatever you want with your data. You can ask that the data processor, if it's a hospital, deletes your data, shares your data, transfers your data. Even there is a right to inheriting, like giving your data to someone else, because it is your data after all. You can do whatever you want. But the technical capabilities to do that doesn't exist. And I don't know any country here in Africa, maybe Chris, you'll tell us, South Africa, where the user can exercise their rights over their data as the law says. Because what happens if my data is in paper, for example? You can't manipulate it the way you want. You can't even locate it. It takes weeks in some instances to locate the data. But even if the data is digital, sometimes depending on which platform the data is located in, even in the presence of the laws and the goodwill on the part of the data custodian to comply, they don't have the technical ability to be able to comply to the law, because the platforms we're using are outdated. They were conceived 10, 15 years ago, when the issues of like the data, the person-centric approach was not there. The interoperability was seen as a connection, back-end connection between systems. Can this system talk to another system? That is, for me, like what we've been dealing with in the last 10 years. The priority today has become, can the system talk to people? And I think we also have the responsibility to promote that kind of mindset shift. Because if we keep thinking about interoperability and breaking the silos by having systems talk to each other, I think that we would have realized in the last 10 years. But can I, as an individual, exercise my right around my data? Do the platforms most, commonly distributed and used in the health sector help me do that? I think that's a challenge that I see us as the technical community lagging behind on the policy people. Normally we are ahead of the policy people, but in this particular instance, I feel like mostly we are lagging behind, because the policy and the regulation have said, okay, it is your right, get whatever you want from your data. But then if I go and ask the director of the hospital, they say, yes, go ahead. But then the IT guy cannot do that. They can't do that because there are limitations. So I would say, just to close, that yes, the challenges are there, the solutions are there. In some areas, we still need to do progress in terms of getting the right legal regulatory frameworks in place. And in some instances, the technology platforms that we've used over the last couple of decades or years are now the barriers. I think there is a case for a reboot. And the good thing with reboot, we can rethink the platforms. We can now infuse AI, which was not there a couple of years ago. Rethink and reboot our platforms. And I think this is the kind of daring moves that we need to start thinking about. For those who have read Nandan Nilekani's book on rebooting India, that is the only way they could put up Aadhaar and start fixing, putting public digital infrastructure everywhere. Is at some point, even if we say there is no legacy in Africa, some good amount of legacy has already been built, but the cost of rebooting our platforms is not as huge, and the benefits are immense. I think with enough leadership and courage, a bit of investments, we can reboot and do things in ways that is future proof. And finally, let me say, because I think Shiko talked about the narrative, the prevailing narrative about Africa as one country. Actually, that's I like that mistake when people take Africa as one country. We should be the ones, Africans, we should be the ones thinking of ourselves as one country and acting as one country. These people who are making this huge mistake, of course, they are ignoring the diversity of Africa. They are oversimplifying. We all know the nuances and differences between different markets. All of that is in place. But one initiative that we are very serious about driving is one digital single health market in Africa, allowing people to roam across borders, still get access to care, still exercise their insurance plans and health plans, still be able to get access to continuity of care, and in the case of pandemics, facilitate the exchange of data so that we can stop outbreaks and so on and so forth. And that requires us to think as one. And all the data protection laws that are coming up, most of them are sort of fixing the sovereignty territory around the borders of the country. And that I find we are going behind, we're stepping behind. I think countries should be more open, perhaps define the sovereignty as Africa, not as each country, because before we realize, we'll again sort of cast in stone the 54 markets that we know is a problem instead of being a solution. So even as we promote data protection laws, I think we have to be very vocal around advising our countries to stop saying health data is sovereign and the sovereignty is defined by our territory, because we know that Apple has my biometrics. I unlock my iPhone using my biometrics, either the face or the thumb or whatever. They didn't ask any permission from the government. We are just making it difficult for our own innovators, while the global tech powerhouses have an unlimited, borderless access to our data, and we just make it difficult for ourselves. It's just like, let's stop that. Thank you.
Yeah, thanks, Phil. I think this mantra of reboot and rethink platforms, I think this to me is very, very important. And to implement this, we might need to learn from some use cases. And I want to come back to Dr. Shiko, see if there is any kind of examples of successful health data interoperability use cases in Africa that we believe can help us in this rethinking and rebooting activity to ensure that we can take a new shape. Our health data governance can take a new shape. Is there any kind of examples that you can think about? And then I will also come back to Phil, thinking about how can we actually leverage some of these use cases to scale them? What is this kind of collective efforts we are doing to ensure that the already existing use cases are being scaled from the continent by the continent?
So I am so sad that you finished with for the continent by the continent, because my one example of interoperability is for the continent, not by the continent. So there is a great pilot that is currently happening in Kenya with, it's called the Rural Health Facilities, RUFA. I don't know what it is in full, by the way, but it's called RUFA. It is the Rural Health Facilities Association. They have done a fantastic, I mean, to be honest, I have to give them credit. They partnered with AWS and a partner in the UK to build basically a One Health system for rural health facilities. Yeah, they're still very like owned by the private sector. Or the RUFA is a private owned facilities association. But the smart part of it is they've installed one single system that is being used by hundreds of small clinics, small hospitals in rural Kenya. And it's a pilot. If it works, I think it has an opportunity to be scaled. It is being run primarily by AWS. It's a project by AWS and a partner of theirs in the UK. And it's working because then each of the small hospitals and clinics don't have to purchase their own systems. But on the other hand, they can be able to share data. Yeah. And they can be able to share patients from one clinic, one small hospital to a little larger hospital. So I think it's good. I'm very excited about it. I want to see how it's going to eventually turn out, but it shows that it can be done. And I think the smart part of this that I loved is that they started with the small clinics and hospitals with 10 beds, small like walk-in clinics that have smaller footprint without the bureaucracy. But the thing is, aggregating them in one system has been amazing, and I'd love to see how that comes out. For me, that is a great use case of how they're doing it. So there's no standards, there's no thing. They're all adhering to one single standard in one single system. They're all being stored on the cloud, which means that at a later date, it will be much easier to do any form of analysis. The second pattern here, I'll toot our own horn as Scala. We have been working with various governments, and I'll pick the one that where I live. They will come for me. Is the government of Kenya in terms of just providing support from a health data perspective. And what we have done is we built a dashboard and back-end system that is able to ingest data and create these amazing visualizations around the health of the country. We started that during COVID, and that continues until now. But what we have seen is, as we've been doing that, we've gotten requests from county governments who are technically in charge of health of the country, because the health was decentralized in Kenya. And we have been working with different county governments to enable us to be able to do the same thing we did at the national level. What we have discovered in the process is that county health systems are very different from national health systems, which means they have some very granular, interesting data sets and data about their patients that will never be visible at a national level. But what is happening now is, as we are building, we're trying to build how does this information then help the national government in making some of these decisions. And we've come to that place where we are aggregating and building one interoperable system across the country. But this is anonymized data. It's not individual data, so it cannot be used for healthcare. It can be used for policy making and decision making, but it cannot be used to make a decision around health. I mean, individualized and personalized health. For me, those are the key ones, but the RUFA one is really an interesting one to watch. The 6 months in, I want to see what happens at 18 months to see how they're using the power of data now to make some decisions. Yeah.
And yeah, thanks, Chico. Now, Phil, how do you ensure that use cases like RUFA are disseminated and probably scaled? What are the concrete measures that are being put in place or planned to ensure that such interventions could be impactful?
It's interesting to hear about RUFA because what I'm hearing is the cloud, that they are using some kind of cloud-based solutions. They are sharing the same platform, and the data storage is centralized. So there is even no need for data portability, because people can move around and still have access to their data, whether they change the provider or they migrate from one rural health center to another one. And I don't know how compliant they are, for example, with regard to the data protection laws of Kenya itself. Because AWS, I don't know whether that cloud infrastructure needs to be located physically in Kenya for that to work, or whether it doesn't matter. I think in the ideal scenario, it shouldn't matter. Cloud is cloud. The whole point is cloud, you should not worry much about where the physical infrastructure is located, because it's mostly distributed. In most cases, it will have like servers for redundancy and purposes. You would have that infrastructure distributed. Does the law in Kenya allow that? Because if it allows, if it's not like an experiment under the surface, if it can scale, because RUFA would be good if it could go and scale up in Rwanda, go to South Africa, go to Senegal, right? and that kind of innovations that we want on the continent that are able to break the barriers. But for that, the idea of a cloud, and earlier on, it may seem contradictory that I said the sovereignty of data should be defined as a continent. I know that even Amazon and Microsoft and Google and the big cloud operators have become sensitive to that issue, and they are all also building storage and compute infrastructure on the continent. And in my view, if such infrastructure exists already in Kenya, it doesn't make sense for a big operator to build in every country. They can build once. So we can say, hey, look at 1.4 billion people, build that infrastructure that can scale and serve the continent. But as long as that infrastructure, at least the primary instance of that data is in Africa, the rest, I mean, like, let's embrace cloud, because we cannot continue hiding our face in the sand as if cloud doesn't exist, and we know it is already there. Our money run is there, everything else is there, even our health is there, only in the hands of the big tech. And then we just tell our own small and medium operators that cloud is not allowed. So I would say my reflection to what Shiko says, whether it is RUFA, there is even another one in Rwanda, it's called ROH, Rural Health Operating System. It's another privately owned network of clinics, of very small rural clinics. They are trying also to scale up in different countries. But I think I'm concerned, and perhaps to close on this point, maybe Shiko, you can come back quickly and say, how compliant are they with regards to the current data protection laws in Kenya? Does the law allow for cloud-based health data storage without imposing a limit on what cloud means and where it is physically located? And if we can have really one good example of a country that is forward-looking in terms of embracing cloud for health, then we can use it even to convert the rest.
I think because I'll just quickly, I need to drop off in a few, but yeah, so based on the feedback I have received, is this, yes, they are compliant, because what they require is a copy of the data in country. You can have a copy being processed on the cloud, but a copy of it in country. And even like the work that we've done previously with GOK is what we did. All the processing happens on the cloud, but the storage happens in country. And based on the RUFA architecture, that's what they have borrowed. Provided you have a copy of the data in the country, they are okay. And we can check, we can double click on that, but they are very compliant. Yeah.
Okay, that's not what Copilot thinks. That's not what ChatGPT thinks.
Mm-hmm.
They think that, and I don't think it's what they think. It is what it is in the law. Actually, the law doesn't allow RUFA to operate the way it is operating. So that's a problem right there.
Somebody saying in Kenya has a local hosted AWS cloud. That's the saying. But during COVID, we actually did make a case for local hosting cloud processing, because you couldn't process all that data locally. It was impossible.
I think, yeah, I mean, let's just take that offline. But I think Kenya has a big responsibility to really lead the way in this discussion.
Right.
I know Rwanda. I know the law in Rwanda doesn't put the boundaries on the country, but Kenya is a typical bad example of data governance laws, because it says the data needs to be physically in Kenya, and if every country does like Kenya, then we will be in that situation we don't want to be in. I think, I know regulation and politics is different, and changing things can take years, but I feel we've just gotten ourselves into a lock by saying data can only reside in the country, when we know in practice it's not possible.
Yeah, I mean,
Yeah, actually, Phil.
Yeah.
Sorry. So to chime in on that one real quick. Yeah, I know we're running out of time. Sorry.
Yeah.
Yeah. So Phil, I totally agree with you that I think for me, it's an issue of educating the policymakers, because I mean, the traditional feeling that your data is more secure if you can physically see your server and that is hosted locally, that your data is more secure that way, I think is a very misled notion.
Yeah.
So your data can be more secure actually in the cloud than it is when you're hosting it physically, because you may host it physically in the country, but you don't have all the appropriate security and appropriate infrastructure to protect that data in your country. So it's an issue in my view about educating the policymakers that your data can be very safe in the cloud. It does not have to physically reside on premise or within in the country boundary. So I see that as a big role of Africa CDC or Africa Union as part of engaging the broad continent in terms of just coming up to speed with what data security really is. Yeah, thanks.
All right.
Okay. Yeah, so Tom, I actually wanted you to share a bit more, but specifically looking at the privacy concern. Like how do privacy concerns affect the sharing of health data, and what measures could be implemented in that? So when we look at this ethical conduct, etc., and how do we address the sharing and interoperability, considering the privacy concern that a majority of the hospitals and data owners might address. What's your take on that? Dr. Tom?
You're muted, Tom.
Oh, thanks, Justine. Sorry. Yeah. So data governance is a major issue, and sorry, the data privacy is a major issue. And as you've said, it's something that increasingly is being addressed by data protection laws. And again, as Phil said, I mean, the laws and regulations often come way after practice. They precede practice. So some of the issues about enforcement, which is one of an issue that Phil raised, enforcement is a major challenge. We know there's appropriate regulations around privacy that's being developed now, like things like making sure that personally identifiable information, for example, is well protected. So if you're going to transmit or share or analyze data that has any PII, this has to be kind of removed before or encrypted if the data is going to be on transit, just to ensure that it's not easily accessed by unauthorized persons. And also just educating the data processors, people who process data or who transmit data or who analyze data and use data, about the need to protect, especially PIIs that would expose either individuals or specific communities that could be very easily identified through their data, and just ensure that that's properly protected. And I think there's the technology aspect is there. I mean, there's all the encryption tools, and data can be properly encrypted and protected as part of the public infrastructure. But there's, for me, I think a bigger problem is just the enforcement of the laws and regulation to be sure that all those that are involved in handling data, from the point of generation of data to the place where it's managed and processed, and to the point where it's used, that all this data protection, data privacy protection are enforced at every stage through the data life cycle, from generation all the way to where data is disposed of. And again, like I said, I mean, the tools are there. The issue is more enforcing the regulations. And the second thing, which comes to more largely around legislation, is the fact that different countries are at different stages of maturity of the legislation. And that's why I think new initiatives like the data model that's being developed by Transform Health and other partners, Helena and others, are talking more about kind of having that model law that countries can adopt and use it to see whether there are gaps in their own existing legislation to be sure that they are protecting the individual rights and ensuring that there's appropriate efforts made to protect data and the privacy. And especially as we move into emerging technologies like now there's a lot of increased use of AI. And I think one of the big questions that we ask in our existing legislation or existing policies is, for example, if my data as an individual is used to train models, AI models, that are then used for prediction as predictive models in future, how exposed am I as an individual whose data is being used to train those models? And is there any appropriate protections that I get? And can I, again, as Phil mentioned earlier, can I withdraw my data if a field is not being correctly used, and stuff like that? So that's, again, part of protecting the privacy of my data and giving me the rights over my own data and how it's used. So those are just some examples of, especially focusing on legislation and policies, besides the technology piece. Yeah, thanks a lot.
Great, thanks, Tom. So there's one question in the chat, and I also encourage the rest of the audience to put the questions in the chat if you have any question. So there's a question from Dr. Jimson Olufuye. Can there be an interoperable cross-border health data across Africa when within countries sharing such data is a challenge? In addition, which authority in Africa is facilitating health data sharing regulatory framework among countries in Africa? Phil, do you want to take that?
I can try. So let me go to the question.
Yeah, so it's asking if there could be an interoperable cross-border health data across Africa when within countries sharing such data is a challenge. Yeah.
It is possible. Some things are actually possible to do across countries than doing within the country. Those who are married, things you can do outside your home, but you cannot. You can be a very good mentor to other people's kids and not a good one to your own kids. So I think nothing prevents us from having that data interoperability framework across borders in Africa. The question will always be, is it enforced? But having it in place, again, I consider that things that can be done just by, a stroke of a pen, regulators or policymakers or lawmakers, voting some law or some policy measure. It's the easy part. The most difficult part is the enforcement. I'm not saying it's easy in the sense that if such a law is introduced, for example, following Transform Health, a model law consultation, I'm sure a recommendation will be put to the African Union and Africa CDC to get that model law adopted by countries. I'm saying it can be easy to get that resolution voted at the level of the AU, but it's not always easy to get it implemented, ratified, enforced by member states. We know what happened to the Malabo Convention, which is more than 10 years old, still has not collected enough signatures to become operational. It was a data protection convention at the level of the African Union. But given collective efforts, and especially if we could still ride on the goodwill that was created by the pandemic in terms of people being open to change more than they usually are, I think we can still push and have that interoperability at the Pan-African level, just by defining the standards that need to be adopted and getting countries to also make those standards, mandatory to be followed in their respective countries. I think that should be possible, even as we continue to struggle domestically to break the silos in the data. So it's not like a question where a problem we need to solve sequentially. We need to solve in parallel, address the domestic interoperability challenges as we also address the cross-border challenges, and I wouldn't be surprised that we solve the cross-border even before we have been able to solve completely the domestic ones. I think we need just to find a very easy way to sort of measure the progress. And I know progress is being done. Until recently, the technical communities did not even know. I think this was one of the findings in the data sandbox report, that even the technical communities did not know that such standard exists. Even those who know that the standards exist, like Smart on Fire, HL7 Smart on Fire, did not know how to, were not trained to use them in their respective applications and so on and so forth. So addressing the challenge from the leadership, policy, regulatory, legal, technical, and user adoption levels up to the end users is a journey. We just need to be able to recognize when we are making progress in the right direction or when we are backsliding. But I wanted just to touch quickly on the point of AI and the question that Tom raised about what happens to personal data being used to train AI models. I think this is a question we really need to discuss. I don't think there has been enough conversation on the African continent. It has happened in other places. Other countries and continents have even settled the question on how to go about it. I mean, depending on whether you are China or US or Europe, I think the debates continue, but at least the practice, we know where the practice is. I think on our continent, the only way we can also be part of the AI economy is, again, to see ourselves as 1.4 billion, as opposed to each country looking at their 10 or 15 million, or if it's Nigeria, 200 million, and say, hey, for us, we are enough. We have enough data about our people to train our models, and we can be part of the AI economy. There is no way that Nigeria will ever compete against India or China if we are not open to encouraging access to health data, properly de-identified or anonymized or whatever, but allow models being created by Africans to have, to learn from data collected from across the continent for those models to make sense. It's urgent. If you saw where ChatGPT is today as compared to where it was 3 months ago, these models are learning extremely fast and getting lost just a bit. It will translate into a huge lag because these things are exponential. So I get really concerned that we keep talking about opening up access to data for AI to algorithm and models to learn from. In practice, we are not doing it. And in practice, we are getting left behind. And we can't just use the word leapfrog anymore, like now or in a few months, because we'll have been left behind too much. So again, what can we do? I think the few people who understand it, who understand the challenge and the threat and the risk, we need to be vocal. I mean, we need to go out there and say, hey guys, forget about the way you thought about data sovereignty, because data sovereignty was informed by this view that data is the new oil on the new gold, and the only way you protect it is to put soldiers around the mine, right? It's not the new gold in the sense that it's not like a physical asset, and the transfer of the mindset of protecting physical assets to digital assets is what is resulting in this kind of mindset. And to shift it is not an easy one. Educate policymakers, I agree. Perhaps for everyone technical conversation like this, there should be 5 talking to parliamentarians, talking to ministers, talking to, director generals of National Public Health Institute. I don't think there is enough of that happening right now. Even countries where laws are being discussed and voted, I don't think there is enough of those conversations. And I want to take the challenge that Tom, you gave us as Africa CDC to sort of lead in that conversation. I think it is our responsibility. We need to make sure that those conversations happen. We need to inspire, not bribe, but we need to find different ways of really making these policymakers understand that in their effort to do well and to do good for the continent, they are actually harming our interests. But the moment they get it, I'm sure they will do the right thing. Thank you.
Thanks, Phil. There's a few more questions in the chat. Slim asked, how relevant is the cloud storage solution when the level and quality of connectivity is very uneven across the continent?
So,
I think this is
we need to
sorry?
move on. I think we need to move on to the next section right now. But as you mentioned, there is a really good conversation happening in the chat. And I want to encourage that to continue happening. I think maybe we'll be able to speak to some of that in the next section as well. But thank you to the first panelists for a really riveting conversation that went into a lot of exciting details that we can hopefully pick up on in this next section. So thanks, Olivier, for moderating. Excellent job. And now I want to go into introducing our next set of panelists who are going to talk about concrete solutions and sandboxes, the role that they can play in unlocking some of this health data value and also providing some of maybe the technical and policy infrastructure for the interoperability that we've been speaking about. So I want to begin by introducing Chris Siebrecht, who is the founder, CEO, and e-health director of Jumbi Health Systems. He's a digital health and informatics professional with a background in biomedical research, computer science, and information systems, as well as in the research and development of digital health solutions. He was the head of biomedical informatics at the South African Medical Research Council before founding Jumbi, a South African nonprofit digital health and data science company, where he's a CEO, and he has an honorary research position at the University of Cape Town, and has been part of the initiation and leadership of the Open Medical Record System and Open Health Information Exchange communities. We're very glad to have Chris with us. Additionally, we have Cyril Sek. Cyril Sek is a strategy advisor at the Ethical CDC, where he plays a key role in establishing the organization's digital transformation strategy and team. He supports the implementation of a portfolio of digital projects, working very closely with member states, partners, and Africa CDC programs. And before joining Africa CDC, he was at Dahlberg, where he provided strategic, organizational, and programmatic advice to governments, foundations, and health organizations. And last but not least, we have Alberto Giovanni Bussetto, who's the Chief AI Officer of Health AI. And he's a member of the World Economic Forum's Global Future Council. He has been a member of the inaugural head of data. He was the global head of data science at an AI at Merck Healthcare, and the first group SVP and head of data at the Adecco Group, a UN Global Compact mentor, Merck Digital Champion, IBM Distinguished Speaker, and task force member of the World Employment Confederation. So thank you all for being on this panel. And Chris, I'd like to start with you. I know you have some slides that you'd like to share about some of the things that Jumbi's up to in the sandbox space. And so I'll hand the floor over to you. Are you a co-host that you can share those slides?
Thanks very much, Justin. Excuse me, sorry. I'm not sure if I can share the slides as well, but I can also go ahead without them if that's okay. They're largely the slides that I presented at the retreat anyway that I was going to refer to, but happy to go ahead with just, I was prepared to also go ahead without them.
Okay, I think you're a co-host, so you just were made a co-host. So at the bottom, share them. But either way, whatever's more comfortable for you.
Okay. So I'm just trying to see if I can do that. For some reason, I'm not seeing an option to share my screen. Oh, there we go. Can I ask if that's showing?
Yeah, we can see this.
Yes, we can see that. Thank you.
Okay, great. Thanks very much. Okay, so I know we're short of time, so I'll just press on straight away. I'm just going to refer to this one slide here, which is the high-level architecture, sandbox architecture that we presented as part of a collaborative effort at the Africa CDC retreat 2 or 3 weeks ago. But I'm going to start off just with by providing some background around the the use of some of the features of Sandbox in the health and other sectors, and the work that we've been doing as part of a collaborative group under the Africa CDC flagship project to try and bind these together into the concept for a regulatory sandbox or a digital innovation and data sandbox that has been proposed. And this was largely a response to the the Africa CDC digital transformation strategy that Phil and others pioneered, and extracting requirements from those in order to come up with a proposal for an Africa CDC, possible Africa CDC sandbox. So to start off on that, I'm just going to talk about some of the background material on the different sandboxes that we looked at before I get on to describing that. And in particular, 3 types of sandboxes: the regulatory sandbox, data sandbox, and what's called digital public infrastructure sandbox, which were all very informative in converging on the proposal that we've come up with as reflected in that diagram that I'm showing. So a lot of this will probably be known by people, but just to quickly go through it. So as we know, the regulatory sandbox is mostly used within the highly regulated fintech industry, where it describes an environment where developers of innovative new fintech products are able to develop these in an environment where the regulations are relaxed and while they move towards compliance and licensing. So an important kind of concept coming out of that is the aim of the sandbox is to provide an environment which really facilitates innovation and the development of new products. So that's a really important function that we need to build into thinking of sandboxes in health, which is this balance between the regulation, or let's say the governance framework, and innovation, and trying to build those together. And reflecting back on what Phil said earlier, I think that's a very important part to try and get right and understand that potentially the regulations, and as they are being formulated, because we know that they are not necessarily as well developed as we would want at this stage, and the innovation grow up together. So Phil was mentioning that at one point tech was ahead of governance, and now it seems to have switched around. Governance is now ahead of tech. So the idea of the sandbox, one of the aims is for these two to kind of grow up together. And we are seeing that in some of the work that we are doing in Africa right now with countries that are busy implementing or bringing out data protection acts. So, and it's exactly what Phil was saying, is that on the tech side, we've been implementing electronic medical records for some time, and now the data protection acts are coming out, and people or the governments are starting to ask us, well, are you able to service a request to withdraw someone's data on the tech side? And we're saying, well, we're not quite there yet. So, so that's one of the aims of that, and that draws from experiences from the regulatory sandbox environment. And then as we know, these have been widely implemented in fintech to facilitate the adoption of disruptive technologies, and more than 50 countries are known to have adopted this framework. Although mostly in high-income countries, and their adoption remains fairly limited in low and middle-income countries. The next one is the data sandbox that the Data Sphere Initiative has described, among others. And these are collaborative environments that test innovative data technologies and practices against regulatory frameworks, much like what I described earlier. And these have, according to the papers of the Datasphere, have been distinguished into two different types: the regulatory sandbox I mentioned, and then the operational sandboxes, also known as data spaces. And these operational sandboxes are a little bit more like what we're used to from the technical side. So environments which are less process driven and more have digital infrastructure which can be used to create and test innovation. So that is also really important because it's another function that we see coming out of the digital transformation strategy, and what we want to see according to that in sandboxes in an African environment, which is really also the ability to stimulate or to facilitate development and testing of digital health solutions, particularly if they are complying to best practices or to regulatory environments. So that's the operational sandbox function. And then the third one that I want to mention is just this digital public infrastructure or DPI sandbox. So that's another thing that concept that Phil mentioned when he spoke earlier. And the DPI, that's the digital public infrastructure, also has a sandbox concept that comprises of two main components, an interoperability framework and a governance framework. So again, we'll see a lot of redundancy or overlap between the different sandboxes, which is great because in terms of putting this together, as we conceptualize of a sandbox that may be useful within an African context, these are the kinds of functionality that we could potentially build into this. So for those who aren't maybe familiar with DPI, it's a set of interoperable and network technologies that facilitate information flow with robust governance and inclusive participation of actors in the given ecosystem, providing net flows and benefits that are accessible to everyone. So it's typically considered the next generation of the way that digital development is done, which is really by creating digital infrastructure across all of government, or some of us are thinking it could be a federated model, which is potentially slightly different in different government departments, like health may be different to civil registration, but essentially it's providing this core infrastructure, which then is inherited and used as a platform on which development is done. So GovStack is a prominent DPI that has been created, and they have developed a sandbox as a demonstration environment for digital teams from governments and service providers to learn and test how to practically implement the GovStack approach. So again, what we see coming into the sandbox from this approach really is, again, the concept of trying to facilitate development and adoption of digital public goods, or what is another common term in DPI is building blocks. So as we talk about digital public infrastructure, we come across this idea of building blocks, and something like, which was really popularized in India on the Aadhaar project that was mentioned earlier, what is digital identity, for example, is a core piece of DPI infrastructure or a building block. So then getting on to just the health sandbox in terms of the concept for a health sandbox, it's a relatively newer concept than the other sandboxes that have been created. And at least the way we've thought of it includes both the operational and regulatory components that we discussed, that I mentioned earlier. The operational part is modeled on the traditional kind of software testing environments that programmers generally use to run code and applications. So when we think of that kind of a sandbox, we think of the connectathon environments that are used to test conformance to standards and profiles that are created in the developed countries, and which we think would be really important within an African environment, particularly as we start to think through use cases like cross-border data sharing, the implementation of the Africa CDC's health information exchange policy and standards guideline, etc., and how these could be provided for in a sandbox such that they both support the adoption of these standards by countries or member states and developers or innovators, and also provide facilities for conformance testing. So standards like HL7 Fire, for example, provide robust implementation guides, which can greatly facilitate convergence on a standard and a data standard, such that it could give real practical teeth to implementing cross-border data sharing or pandemic preparedness. So just to mention that these are some of the concepts that we thought about in the Health Sandbox, and the conceptual model is sort of what I'm showing on the screen there. And you'll see at the top some of those use cases coming out, and then drawing down to the bottom layer, which is the technical implementation of that. So just to cover very quickly some of the innovative solutions, this was the other guidance question that have emerged. As I mentioned earlier, the idea for the Health Sandbox is rather than forcing burdensome compliance on startups, is the Regulatory Sandbox tries to foster this welcoming environment where to encourage people to conform towards conform on the regulation, and potentially even leading towards licensing, which could be adopted in multiple countries, which serves as a carrot to organizations to open up markets to them and improve the sustainability of their different products. So just in the interest of time, I won't go into all of these, but India has launched a regulatory sandbox for fintech and extended that into innovative healthcare insurance products. Singapore has a sandbox arrangement to test amendments to the country's Personal Data Protection Act. And Indonesia has a regulatory and health sandbox that has been used both for telemedicine as well as for a e-malaria use case. So we are starting to see the emergence of some health sandboxes in low and middle income countries. I don't know of anything in Africa at the moment, but that is kind of what we've been working on. So as I mentioned, we have the privilege and pleasure of working with the Africa CDC and with Phil and Cyril and other collaborators, including Carla, DataSphere, Gembi, etc., on the concept for a digital and data innovation sandbox. So that concept that I'm showing on the screen there. And the aim is to design the system along the lines of what I described earlier, having that kind of functionality of the regulatory, the data, and the DPI sandboxes built into it. As to Phil's earlier point around needing systems, one of the functions is to enable the discussion between tech and regulation or governance to ensure that two grow up together. So along the lines of my example around the Data Protection Act and the access to personal information, so the tech and the governance and all regulation informing one another as they are implemented in Africa. So some of the opportunities for a sandbox like this is it can provide an environment where policymakers and regulators can implement best practices and guidelines and guide innovators to develop new solutions more rapidly using best practices, can implement, I mentioned before, the Africa CDC Health Information Exchange Policy and Standards Guideline. We're also looking at the scenario of including the health data governance framework, such as the one developed by Transform Health, and having the regulatory components that they are formulating potentially turned into testable components in the sandbox. So we see a nice line being drawn from governance to the actual implementation and testing, and that extends also to the smart guidelines developed by WHO, and also to support data sharing, protection, and potentially the sovereignty issues within and across member states. So providing the standards and legislative fragments required for that, as well as for responsible AI. And then I mentioned also supporting compliance testing of standards and profiles adopted in terms of the Africa CDC policy and the concept of DPI, by also facilitating the adoption of common infrastructure components and reusable building blocks. Another interesting aspect to it, which came about during the retreat, was to include a One Health approach, which is, I think, really important if we think of the pandemic preparedness, and to draw in data from veterinary and environment components, as well as potentially genomics in the long term, and advanced laboratory diagnostics. And also to, I think, try and sort of in some way conform to what the GovStack sandbox looks like as well, so that if possible, one can also have health connect with what is being done at the DPI level, and then provide software development tools and synthetic data sets to facilitate development. So those are some of the functions that we are thinking of at this stage in terms of a health data sandbox. And as I said, the design for it is in that figure on the screen. Thanks very much.
Thank you, Chris. Now I'd like to bring in Alberto to speak to the work of Health AI. Health AI is a new partner in our Africa CDC digital transformation strategy group. And we were privileged to meet Pei Ling on the retreat and hear about some of her work. But Alberto, it's great to meet you, and would love to hear about some of what you do at Health AI and how you're thinking about health data governance and the role that AI can play on the continent with regards to that as well.
Thank you so much, and thanks for the kind introduction and for having me here. Health AI is the global agency for responsible AI in health. Myself, having a background of now almost 20 years in artificial intelligence, and having been an innovator myself in AI and health, I can only appreciate the power and the potential of Sandboxes in particular. I think they're a fantastic platform to bring together innovation and innovators, and also to develop technology more generally, and in the case of AI specifically, to the benefit in this case of patients and providers for health. I think it's fair to say that AI is a relatively new field, although it's also true that many algorithms have been developed in the past decades or are around since a very long time. And it's even more so the case that generative AI is a particularly new technology, and one could also claim in many ways a technology that is not yet fully understood and not yet mature. And taking into consideration the fact that the innovation cycles in AI and generative AI specifically are so fast that one has to kind of rethink a little bit kind of the way you can govern and regulate these technologies to ensure that it's truly a win-win-win for innovators, providers, and for society. And so one has to acknowledge that and to see that this is an opportunity for learning. And sandboxes, in my opinion, are one of the best ways to learn for regulators. So there is that kind of aspect of regulatory learning, and for innovators and providers. So sandboxes are now, of course, becoming more and more popular. On the one hand, it's a good thing, even an excellent thing, I would say, that there are just so many initiatives globally. I think, if I'm not mistaken, we're now well above 100, sandboxes globally. And taking that into account, I think it is also, the right time to harmonize sandboxes to the extent that this is possible, and to use that as a platform also for collaboration. Clearly, when it comes to innovation, regulation, and also delivery of highly technological solutions, there is a certain kind of global fragmentation, many different jurisdictions, many different kind of regulations, and also upcoming regulations. From the perspective of providers and innovators, I think it would lower the barriers to the development of responsible AI, to have sandboxes that can not only have a certain kind of degree of harmonization, but perhaps even interoperability and transferability. of the results and the solutions. I think this is an important thing. So maybe one of the first kind of keywords, if I think about, you know, the responsible AI in health in the context of sandboxes is collaboration. Collaboration will make, you know, innovation less expensive to perform, because it will lower the barrier for providers and innovators. The second keyword is transparency. Sandboxes are an excellent opportunity to better understand, in general, AI in health, and in particular for a specific type of solutions in the clinical setting and in the delivery, and even beyond that, how AI can be developed in a responsible way. And when I talk about transparency, I really mean end-to-end transparency. And so what it means is transparency in the data, in the benchmarking, in the type of solutions, in the types and families of algorithms, including their architectures, and also finally in the way these things are tested and assessed. And ultimately, another keyword that I would like to mention in this context is that of fairness. So to create sandboxes, and when I talk about sandboxes, I'm not only talking about regulatory sandboxes, that are of course kind of super important, but even more so for innovation sandboxes, right? They are bringing together not only the regulatory aspect, but also the enablement of sustainable and responsible innovation. Fairness in this context means to me creating a field that rewards responsible development of technology, that avoids shortcuts, and that makes it a fair field for fair play in the development of technologies. This is super important, and it also starts with fairness and certainly also transparency in the eligibility for developers of new technologies and innovators more generally to be supported and to be part of sandboxes for AI. To be a functional a set of sandboxes for responsible AI and health has at least 3 ingredients. The first one is on the data side, reference data sets that can be used for calibration, for evaluation, for experimentation. So the first part is very much on the data, including making certain reference data sets available. The second one is on the processes and the feedback loops to evaluate and improve AI solutions in healthcare, and which might also include, advising feedback loops between regulators and innovators. And then the third element is platforms, also on the technical side, that would allow streamlining, and even in some cases, if possible, some elements of automation. So in that sense, regulatory and legal tech to make innovation possible, to make sure that, like regulation is not a barrier to innovation, but rather something that enables innovation. And certainly artificial intelligence in particular is the type of technology that I think also naturally lends itself to also help on the regulatory angle as well.
Wonderful. Thank you very much for those comments, Alberto. And I definitely have some questions for you in the follow-up session. And now I want to turn it over to Cyril Sek. Cyril, having heard some of these comments, I'd love to hear the Africa CDC's perspective on some of these issues. On the value of sandboxes, and also how you see kind of harmonization in the health policy and health data space. We've talked a lot about harmonization, and I want to understand kind of the Africa CDC's role in fostering some of that harmonization to create a holistic environment where African health data can be shared effectively, and where we can take advantage of some of these crossovers that can happen through a continental convener. So the floor is yours.
Thank you so much, Brian. Justin, I keep on, on mixing those two names. Sorry. And thanks to the previous panelists. So, you know, they say that sandboxes are just for kids. You know, they're also for data scientists. They're also for policymakers. I've been trying to chat with a few of you. And I think the sandbox is basically a place where you can try out new ideas. And why should you try ideas? Because you know that there are so many challenges that you're not actually addressing. Let's start with the fact that we only have one medical doctor per 5,000 people in Africa, compared to one per 250 in Europe or one per 400 in the US. So we have major challenges, and we all believe, otherwise we wouldn't be in this call today, that digital is one of the solutions, not the only one, but a great solution. So now, how do we address that? We need new regulatory frameworks. We need to make sure that data is available. Our colleague Alberto mentioned generative AI. You know, those companies, Meta, OpenAI, Google, I believe, from what I've read, they've already scrapped the whole internet. Now they're going through the videos, and although there are some regulatory issues. But you may know that 87% of the information on the internet is actually in English. I'm Francophone, and we have so many different languages in Africa and so many different ways of living and cultures. The fact of the matter is that if we do not digitize, and if we do not go beyond the borders of our little 55 countries, we will not feed into the models. We will not reap the benefits of innovative tools and digital approaches and tools, or they will be biased. We don't want that. I will not go back to the story of that great startup that there was in Rwanda and that collapsed last year. But we really need to make sure that we have digital health data available. So that's I just wanted to say that to start with. But sandboxes can be designed, you know, as controlled environments where new solutions can be tested under real world conditions. That's really the definition of them. And I think there are three specific topics that are important to test. The first one is really the interoperability. Then the second one is the data privacy, and then the third one would be cybersecurity or security, generally speaking. Because those are the three elements that we know are critical to expanding those markets and those spaces where we can exchange and play with data. And those are also the three, especially based on the chat discussions we're having now. Those are the three areas where policymakers are stuck. They're extremely strict on that. So we need to bring governments, private sector, you know, youth or not so youth, but anyway, innovators and civil society, so that we can play and show what works, what doesn't work, what should change. And there are a few examples of that. So on the question of interoperability, I mean, what we're really trying to address is fragmented health information. With Phil a few days ago, we were discussing and trying to understand the diversity of solutions and tools that are being used in Africa. And this is crazy. It's extremely innovative because many NGOs come with their own solutions. And that is an issue. But at the same time, this is what innovation is about. So there is this great example from Kenya. I believe the nickname is the Roundabout. So they basically have a health information exchange platform that is, I believe, a prime example of what many countries, or even at a larger scale, we should do. The idea of regional database is or working on a regional scale is important. So yeah, the first really big topic is around interoperability. Then I believe sandboxes can be used also to and maybe this is extremely repetitive to what Chris said earlier, but to test data breaches and all the privacy concerns that everyone speak about. The one element that I'd like to add is that we can't overlook that, because if we do have a major issue, we may burn our bridges for many years. If the society, if the citizens, if the patients, face a major concern, we will take a few years to regain their trust. So we do have to be strong on that. And I think there is one example in South Africa, by the way, with the South African National Health Lab Services. Okay, I don't have the full example, but we all can Google that. I think it's about real-time threat simulations to basically assess the resilience of their encryption protocols, I guess, and yeah, that's just one example, but there are many. And then there is the question of the fact that stakeholders, they need to collaborate, and they need to learn how to work together. And yeah, that's the example. There is the Health Tech Hub, obviously, with a great example that at Africa CDC, to go back to your question, Justin, we're trying to promote and multiply, amplify. So if I am to go back to the question of clouds and sovereignty, etc., I think Africa CDC can be also a middle ground. We can bring the critical mass to have some services that could be made available to countries, but it is extremely complicated to compete with AWS for obvious reasons. But really, our role is to, in this field of the data sandbox and many other projects, is to make sure that digital tools are being weaved into national health systems, so that we deliver more to patients, but also that countries can work better with each other. So let me pause here. This is very high level.
Yeah, Cyril, thanks for your comments. I guess a follow-up question. Has Africa CDC entertained the idea of partnership with somebody like AWS or one of the big cloud service providers in terms of helping to create that large continental ecosystem for health data sharing and exchange? It would seem like there might be interest from one of those players in terms of collaborating with an entity like you, rather than maybe pursuing country by country implementations. I would just be curious to know about your discussions with them, if any had happened, and the role they may or may not see themselves playing regarding
the short answer is yes, we're speaking with them. We're exploring various models that could be implemented to make sure that there are great services and great price tags, because it's really about price and continuity of service could be tapped while addressing the sovereignty issues of many countries. And even the strongest countries, when it comes to digital, do have those concerns. So it's not something only from that would emerge from countries with low maturity. Rwanda is actually quite strict when it comes to data sovereignty, as we all know. And when you look at what is happening in Europe, I was, adding that to the chat box. It is also a bit complicated. It's the same discussion that we're having when it comes to mining. Do we want to export or to cocoa in Ivory Coast? Do we want to transform, or do we just want to release the data and the smart, interesting things is happening outside? It's a balance, really. It's a balance. So that's why we're speaking with them. And so I can't go into the details, and I don't understand everything, I have to say. But there's some parts, and I believe one of the previous panelists shared a few words about that. There are some parts that can be in country or in a friend country, a country that you trust, because actually some regional economic communities have, such as the one in West Africa, ECOWAS, they have institutions with a strong mandate to integrate all health capabilities. It's WAHO. So you do have the possibility to keep some data in what you think is safe and do some of the analytics outside. But when you start looking at the details, it's not that obvious. But if I take one step back, at Africa CDC, we truly, really believe that collaboration with the private sector is critical. Collaboration with all types of stakeholders is critical. Governments obviously provide and define the playing field, but the innovation comes from the private sector, obviously. Yeah, maybe I can share a few words about the portfolio of projects, because both Justin and Chris mentioned them. So we have a digital transformation strategy and a portfolio of 18 now specific projects where we embark a group of organizations that share a similar vision with us, and that see value in collaborating with their peers and with us to make sure that there are no gaps, and that they sequence their work and they learn from each other. So at Africa CDC, we're not objective is not to elbow in our way and do what other organizations do better. It's more to convene everyone and to align everyone and make that connection with the countries.
Thanks, Cyril. And Chris, one final question for you. I want to talk, because we're close colleagues and I know you, I want to talk a little bit about your work on standards and interoperability and the projects that you've done at GEMBI in this regard, and what have been your successes, and what do you envision as being some of the challenges of mobilizing this interoperability that we've been discussing at greater scale for the continent versus maybe in-country implementation or one across two countries?
Thanks very much for that question, Justin. So, obviously we are deeply entrenched in interoperability and standardization, which has been a core focus of ours for some time. And we are seeing quite significant traction in country. So just in terms of interest in interoperability and the whole area of sort of enterprise scale architecture, which is really trying, how do you create interoperable or integrated systems at national scale? A lot of the countries in Africa at this stage, I'd say almost the majority that I've seen have that as part of their digital health strategy. So interoperability is seen to be a critical next step for countries to get to. And there are countries that we've worked in and others that are achieving some degree of interoperability and have national data warehouses and data flowing back and forth, as well as standardization to international open standards and profiles. And I should just say that we're a strong advocate of open architecture and open standards. In addition to although we generally develop open source, It's really the open architectures and open standards that really matter. And where this might all be going is that's the benefit for us of also working in Southeast Asia, is we partnering with the digital, or one of multiple partners of the Digital Transformation Office in Indonesia, that's building essentially an interoperable health information exchange system for the entire population of, over 250 million people, which they are doing as a cloud-based system in partnership with Google. And they have one shared health record at national level and are integrating all of the different health services into that. So that kind of provides us with a bit of a blue sky vision of what Africa could look towards doing in future. So that's the trajectory that interoperability, standardization, data exchange could take, and why I think Phil was so much on the money, saying, we need to really understand is the fears that we have and hear around using cloud. Are those really in Africa? Are those really justified, or are they red herrings and misunderstandings of what or of how you can really use cloud? Because certainly the biggest scalable systems we've seen are using cloud. But that said, I also want to throw a spanner in the works and just say that at the same time we are seeing the rise of AI, we are seeing the complexity and the expense in putting together large-scale interoperable systems in Africa and in other low and middle income countries, and really asking the question as to whether, as many are, as to whether that same level of functionality might soon be provided by AI-driven systems. And whether it's generative AI or some other new technology that's coming out, is that going to do the same for us as what we are currently doing with standards and a very labor intense and technically demanding activity of creating standards, storing data in standardized formats, making it interoperable, interfacing systems, etc. is all very technically challenging. And we think that AI is going to potentially disrupt that particular process in ways that we probably don't understand yet. Thanks again.
I really appreciate it. I'm going to hand it back over to Lorraine, who's going to close us out.
All right, thank you. Justin, do we have results that we can share of the Menti or not yet?
Fortunately, I don't think we do.
Maybe we can include the link here too, so people can input their answers again. It would be nice to see that, because one of the things that we wanted to see exactly was, is there sufficient resources and awareness of issues regarding data interoperability in the region? Is there the level of leadership that is needed to address the complex issues that we have addressed today? What about the narratives around data sovereignty? We had a fascinating conversation in the chat today amongst different participants. So the exchange was really lively. And I, for one, really, really enjoyed the exchange that we had today. I thought it was fascinating. We went through so many different topics and how that's really weaving together multiple concerns, and one that is not a concern of only one country, an opportunity of only one country, but really our region and globally as well. And that's something that I mentioned in the discussion that we're having in the chat. For me, the most complex issues that we have today in the world, be it climate change, the risk of pandemics, the issue around governing emerging technology, all of these require cross-border collaboration, and they require multi-stakeholder collaboration as well. It's not governments alone that are going to solve this. It's also with partnerships with experts in the private sector and academia and researchers and scientists and civil society. And in order to achieve that, I believe that we need new agile methods to collaborate in a way that really it can really challenge the traditional methods of international cooperation, where it was typically based on the state and the representatives of the state, but really now leveraging expertise and resources from multiple sectors and stakeholders. And Sandboxes can be that space. Sandboxes conceived in a very generous way in terms of a conception of being regulatory sandboxes, operation, innovation labs. They can be that space where we can iterate through solutions, and they can be used at this space to provide cross-border cooperation. And I am convinced, and I've been convinced for years, that health is a space where these solutions can thrive. The first report that we wrote on Sandboxes, that was with support and funding from the UK government, which is Sandboxes for Data, that we published a couple of years ago, we looked into this specific case of health as a potential use case for cross-border sandboxes for data. And there's so many different ways in how we can go about looking into the issue of interoperability, or issue around licensing in a sector that is extremely regulated. And so I'm really excited to see that the discussions and the dialogues that we're convening in the context of the Africa Sandbox Forum is helping and enabling this conversation to be kept going, also because we need to create, in my opinion, this community of practice that really fosters this conversation, not only in Africa, but beyond the region as well, bringing in experts from different regions and different countries so that we can build on the good practices and the innovations of other regions in the world. And at the Datasphere Initiative, we're convening as well the Global Sandboxes Forum, where we identify good practices and experiences of sandboxes in multiple sectors in different parts of the world. And the idea is really to build that community of experts that are trying to advance agile methodologies to solve really complex policy issues. And health is among one of the most complex issues that is out there. And so I'm really excited to see that this roundtable is really the manifestation of that, of the building of this community. And I think that we can see from the engagement up to, of 2 hours of workshop in a Zoom call, which is, it is not obvious to keep everyone engaged, but also in the multiple exchanges in the chat on the fact that I think we were successful at identifying people that care about this issue. And for me, I really wanted to end this call with a call to action from you. So maybe I can ask the speakers who are still here with us to share in a tweet length what would be your call to action of what we need to do together as of now in order to advance on this issue. And maybe I'll start here with we can do a kind of ping pong of the different speakers, but Alberto, you're the first in my screen here. If you can share 1 or 2 sentences on your
Absolutely. I think this is a fantastic opportunity to collaborate, to build a community of practice that moves in this direction, so that it's really a shared, call for action. And also, I believe for many of the things that we discussed, a very important enabler would be that of data and AI literacy, right? So that all players and all stakeholders can participate, right? And build that vision together and make that a well-informed and very active community of practice.
Great. Chris.
Great, thanks. Trying to think on the spot here, trying to get my thoughts together. I think mine, I hope I can get this out well enough. I think my thoughts would be along the lines of trying to create a shared, or let's put it an environment where data, technology, and regulation can coexist and self-reinforce each other. Well, let's also include AI in that. I think to the earlier points and contribute to creating the single digital market in Africa that Phil was mentioning.
That's great. Cyril?
I'll go also with the single digital health market, but maybe one first step would be to consolidate in a single database everything we have on neglected tropical neglected diseases, because very often our academics they have really like big issues tapping into the data. So let's start with this very simple issue, not simple to address, but there is a clear need. It's happening on our continent, and the data is scattered. Let's make sure that maybe starting with 2 countries and 3 countries that sign MOUs, we make sure that our universities and others from the world could work on a larger database.
And that is so interesting for you to say, Cyril. I think often when we talk about cross-border sandboxes, we tend to think as very, very big initiatives that necessarily include, a whole continent or multiple countries. And a cross-border sandbox can be simple as simple as 2 countries that are collaborating across border, right? And so if you can start small as well with this kind of data collaboratives that are between 1 or 2 countries and then grow that incrementally, maybe we can do that gradually as well. If anyone has a burning desire to share their insights or call to action, feel free to raise their hands as well. I know we didn't give that much time for participants' participation, but if you feel like speaking, now is the time. I don't see any hands up. So I guess that everyone has other commitments to attend, and we do like to end our meetings on time. I really would like to thank everyone for their participation. Feel free to write to us with any other insights or ideas. A lot of different comments were exchanged here in the chat. We are happy to remain connected. We'll have other regulatory roundtables as well. But I'm just very glad that we did one in-house, and hopefully that's not the last one as well. So we'll keep in touch with you in different occasions as well. I'd be interested in continuing in touch with the Africa CDC in terms of the efforts that you're carrying out. And just I'd like to thank you all for joining us today. I think it was an excellent session. I hope you thought it too.
Thanks for the moderation, Lorraine. And
Thanks
Olivier,
very much.
and Brian, and Justin.
Thank you so much.
Thanks,
Thank you so
Lorraine.
much.
Thanks, Justin. Thanks all.
Sure, Chris.
Thank you. Bye-bye.